Okay, hi, good morning, everybody. Thank you very much for joining me again on today. A very good subject. The reason is because of the fact that, a lot of people don't realize stroke can be a very, very potential dangerous stuff that can be detrimental and life-threatening. I treat many patients who are stroke patients come to ICU. And really, at the end of the day, many of these patients actually during the stroke, they didn't expect it. And matter of fact, the family didn't expect it. So just happened they identify this time that, oh, they are stroke. And the time get to the hospital are so important and so critical. So, and especially you're diabetic, wow, that even worse. The reason is during diabetic, your vessels are all hardened and could be in various different stroke. And I will talk a little bit more later. So stroke, especially when we get down to 50, 60, 70 years old, this is a time when a stroke will come if you are not taken care of. Like, for example, your hypertension, diabetes, high cholesterol, all these will be related, potential be a stroke victim. So that's why today I think is a good way to at least talk about what is this stroke all about. At least you are now alert and do not go out if you're a stroke to go back to a typical doctors, because any time of delay is truly a potential, life-threatening and also potentially, cost you, recovery very, very difficult. So that's the reason why I thought that this lecture will be, or this webinar will be really good to at least let you know what is that consists of and how you identify and how you can prevent it. 各位朋友，我係 Angela Lowsutea President， 你好，多謝你喺星期六嘅時間，亦都大家聽我哋個 webinar。嗱，其實咧好多謝今日咧好多朋友喺不同地方嚟啦，夏威夷啦、美國羅省啦、加拿大啦，好多個不同地方嘅。但係好重要嘅了解，原來咧 stroke 咧係一個好大嘅問題，同埋咧尤其是咧糖尿病咧，你多數你血管你好硬化啦，咁 stroke 嘅時候咧係要真係好快去睇醫生嘅，咁你一定要知道呢啲係咩問題啦，咁快去睇醫生嘅時候咧，你就可以即刻去處理嘅你個即係中風嘅風險啊。咁相比咗嚟講咧，我醫咗好多中風嘅病人，但係咧如果你遲入醫院咧，同埋病人係糖尿病咧，哇！嗰個情況係好慘嘅，即係更加係嚴重，同埋好難醫好啊，或者即係瞓喺度好多年啊嗰種啦。咁一瞓喺度好多年咧，你就好多問題出現㗎啦。所以我都希望大家咧知道早啲了解呢樣嘢，就唔會 fall into 呢啲咁嘅東西。真係我哋話齋好 suffering， 個病人 suffering， 個屋企人就 suffering 喺中風嗰度啊。Okay, good. So today I'm so happy to have so many people from all the different places, including people from Hawaii, Los Angeles, Canada, United States somewhere, Hong Kong, and all different places. So what I will do is, first of all, I will share my screen, and then we'll go from there. And hopefully that you guys go see my lecture. And today we will start off how really diabetes related to stroke. So that way you will be very, very have a good chance to understand. So that result, you will be able to really watch instead of didn't know and end up delay your time to go to hospital. Wow, that would be terrible. You don't want to have that opportunity, which you can be treated without very lot of late delay. So, and I just want to make sure that people can hear me and see me. Edwina, can you just give me a 1 if you can, to able to see me in the either a question or chat box, so I know that you can see my slide in the Zoom is really good. Anyway, that's what we're going to talk about today. I think that will be really good for everybody to better understand what it's all about, why there is stroke and diabetes is so important. Okay, but I saw a lot of new names today in our webinar, so I don't know, these people are probably new to our group. So I would like to take really fast to catch up what is the 4 stages of diabetic and how Lowsutea can help you. And then after that, we'll go into diabetic and stroke relation topics. Okay, so first of all, everybody, remember, everybody will go through 4 stages of diabetes. Now, the reason why I keep repeating that is because then I want you guys to all remember this. So with that, then you'll be always kind of understand what is going. Because the first stage is really the LDL goes up. Because when LDL goes up, you know what? Your LDL cholesterol goes up will damage the B cells, which is supposed to take the take the sugar into the cell. But the insulin come out of the B cells are damaged, no longer take sugar into the cell, then the blood sugar will continue to increase. When that happens, the cholesterol and the sugar mix together, the blood becomes very thick. When the blood becomes thick, your problem comes in. Move to the second stage, because when you're thick, it starts plugging everywhere. That's the reason why diabetes is a lifelong disease. If you don't take care of it, your whole body, brain, kidney, heart, everywhere will get plugged. So net result, this plaque is going to form everywhere in the body. The net result, your blood pressure goes up. When your blood pressure goes up, your problem will occur, because the next stage, besides blood pressure go up and you continue to plug, eventually your sugar will be continue also goes up. And then the doctor will start measuring you to say, wow, okay, are you still okay? And they all use the same measurement. It's called the HbA1c. HbA1c is a protein that amount of blood sugar will attach to this hemoglobin, HbA1c. The hemoglobin, if you're under 5.7%, you're a normal person. If you are over 5.7 to 6.4%, then you are a pre-diabetic. If you are over 6.4%, if you don't do anything, and then you basically just do not take any additional effort to lower your blood sugar, in 3 years, you will convert to a diabetes. And that is very much studied and show almost pretty much just as the same. So you really have to take effort when you get down to pre-diabetic. Don't get yourself to convert it to be a diabetes, because once you convert to diabetes, you know what? You cannot go back, okay? Now, the sad part is when you're pre-diabetic, you know what? You have no medication. Doctor will not give you medication. They said, okay, you are pre-diabetic now, you got to do some effort. But unfortunately, majority of people really don't know what happened and they don't know what to do. So they continue the same lifestyle. That's why they go to the diabetic in about 3 years. So keep that in mind. If your A1C is over 5.7, you need to start to act very, very aggressively to keep it below 5.7 or keep it below 6 at least. You're still continue to be pre-diabetic state all the way through in about 20, 30 years. But you save a lot of money, because if not, you know what? The cost of diabetic patient is $16,700 per year as of today's price of people who are diabetic patient, additional medical costs. Imagine that if you do it for 20 years, that saves you $300,000. Imagine that, $300,000. You didn't hear wrong, okay? So I don't want you to be really at that to have all these costs for yourself to healthcare, right? 各位同學 ，hello！ 我見到今日咧好多不同嘅病人啦，好多不同朋友啦嚟到聽我哋講嘢啦。咁有啲係我真係唔 recognize 嘅，可能香港邊度啦。咁唔緊要，我今日咧會再解釋下咧，就係第一，糖尿病有4個 stage。第一個 stage 係 LDL 膽固醇上升啦。當 LDL 膽固醇上升嘅時候咧，咁佢咧就會 damage 嗰啲 B cells。B cell 帶啲糖入去個細胞裏邊嘅。當啲糖入去嘅時候咧，血糖咪一路係咁慢慢上升啦。當慢慢上升嘅時候咧，弊家伙啦，嗰個又 move 咗嚟 stage， 因為咧糖加埋咧啲膽固醇咧個血變咁好結。LDL cholesterol 加埋糖好結嘅時候咧，咁就開始 plug everywhere， 成身嘅血管都係咁塞。嗱，當然啦，你塞1年2年冇乜所謂，哇！但係塞5、6年咧，你就好有問題嘅啦。所以變咗嚟講咧，就開始血塊開始慢慢塞咧，咁你就會變咗你血壓就開始上升㗎啦。咁你開始上升之後咧，你個血糖一路係咁高啊嘛。咁變咗嚟講咧，你個每個全世界醫生都係用呢個方案嚟就 measure 你個紅血球有幾多 percentage 嘅 糖黐喺呢個 hemoglobin 呢個紅血球度。咁如果你 under 5.7咧，咁你梗係正常人啦。如果 over 5.7至6.4咧，你就前期糖尿病患者。咁你係要可以做嘢，因為呢個時間冇藥食嘅喎。醫生話俾你前期患病咯。好多人就唔知咧，繼續做嘅生活一樣同近時一樣咧。咁如果佢3年裏邊咩都冇做啦，咁佢就轉咗去咩啊？糖尿患病者。嗱，當你轉咗糖尿患病者，你就翻唔到轉頭噶咯。所以千祈唔好做呢樣嘢，因為做咗呢樣嘢之後咧，你身體亦都唔會好。你一定只有控制嗱，其實糖尿病咧係一個一世嘅病，唔會係醫得好嘅，只係可以控制。所以希望大家努力去控制呢樣。So everybody really have to be in effort. Try not to go into diabetes. If you're pre-diabetic, stay in that stage is okay. As long as you under 6 or under 5%, it will be better. So keep doing it. Because if not, you know what? Your diabetes is going to come in with all kind of problems. Because you could be a stroke problem. Remember the first thing I said is stroke. You lost of memory. I saw a lot of older folks this town keeps asking the same question over and over again for 20 times. One of them is actually my mother-in-law. You keep asking, oh, have you had dinner yet? In every 2-3 minutes, keep asking the same question. The reason is because she's a diabetic. The blood are clogged in front of her brain. She cannot, the blood doesn't go through, so she can remember the short-term memory. So it's really sad. And on top of that, now the third stage of, that more people now realize there's what I call type 3 diabetes is Alzheimer's disease. Wow, imagine that. That will be terrible. Second, you might lose your eyesight, glaucoma. Also, you know, pancreas, you have to inject pancreas, meaning inject insulin. So you're going to have another issue. And then heart disease will be a big one because it plug up your coronary artery. You know what? If you don't get that fixed, your heart is going to stop. Once it's going to stop, you're end of story. So don't want to get you in that because I have worked with a lot of patients now who have high cholesterol, diabetes, and I get them to actually go to see a cardiologist, to help them save their life. High blood pressure is another one, which is really, as you know, diabetes, one of the problems is the plugging everywhere, the whole body. So your blood pressure is going to go up. Your heart vessel will harden and damage your vessel. Now, nerve damage, a lot of people don't even know. Nerve damage is basically the nerve because of the fact that the sugars are getting plugged and the nerve cannot get proper conduction. So you don't get the feel. Even heart attack, you don't feel the sharp pain. You feel, maybe stomach pain. And you maybe miss that heart attack. So that results a lot of people who actually diabetic heart attack, they really very serious, or they might end up death. And then amputation, because you don't feel, you're going to hurt yourself, you don't treat it, you don't get well, you might even lost your foot. Diabetic nephropathy is another one that you might end up will be dialysis. And also because you have nerve damage, you have no feel. So, 30% of the diabetic patient have no sex life. And then pregnancy complication, that will be also very sad because if you're pregnant, unfortunately, you can't get well, and then a few years later you become a diabetic. So all that is your diabetes complication. So people who are having, don't control the sugar, this is something that you need to start taking effort. And I'll tell you later on more why stroke is so important for you. 各位朋友，即係好重要咧。其實好多人唔知道咧，原來糖尿病嘅併發症咧，如果你唔去緊張去管理啲糖咧，你真係好有問題喎。因為第一個就係嗰個中風嘅風險啦，同埋唔記得嘢嘅風險咧係一個好大嘅。第二，你可能睇唔到嘢啦，青光眼啦，或者隻眼蒙咗啦，咁啊好慘喎！我有啲病人40零歲，一隻眼已經蒙咗睇唔到嘢嘅，或者佢係睇到好蒙啊。咁你諗下，如果一個40零歲睇唔到嘢，做你去60歲、70歲有23年嘅生活，哇冇陰功係咪？咁呢個咧真係要唔好令到自己變咗咁啦。咁你當然啦，有好啲要打胰島素啦。心臟病係一個好大問題嘅，因為佢啲血管係咁塞到個心嗰度咧。個心停咗你就玩完噶咯，所以記住啊，唔好去呢笪地方啊。咁仲有咧，血壓高啦，一定係有啦。你見到第二個 stage 咧，血壓高啊，因為全身咁塞噶嘛。咁因為咁樣情況下咧，血管度硬化啦，血管係 damage 啦。咁呢個神經系統亦都會 damage 喎，因為咧個血塞咗喺個神經嗰度咧，佢哋冇感覺，就算 heart attack 都冇咁痛。咁所以變咗嚟講，你唔知道咧，就 end up 咧就唔理佢，咁你就 end up heart attack 好大件事嗰時候咧。你處理唔到，你就拜一拜啦。咁同埋仲有咧，你因為 痛整親隻腳啊，你又感覺唔到啊，咁你唔理佢咧，發炎咧發到隻腳又可以斬咗佢啦。腎壞咗之後要洗腎啦，同埋咧30% 嘅糖尿患者係冇性嘅感受，因為佢冇個神經喺度損壞咗啊。咁如果你係懷孕嘅個併發症就係你係譬如依家已經懷孕有 diabetes 咧，你到5-6年後，就算你好翻之後，你個 risk 係好高嘅。咁記住呢啲係即係糖尿病嘅即係全身嘅影響咧，所以呢個真係唔好行呢條路啦。OK。So you might ask why Lowsutea can help you. First of all, Lowsutea has only two items in there. One is called guava leaves. What it does is it delays the absorption of sugar entering the blood vessels, so you don't have more sugar going to the blood vessels. Two is that even if sugar in the blood vessel, there's a thing called bitter melon, which is really help to increase the sensitivity of the sugar of the insulin, so it will take the sugar into the cell, increase the insulin sensitivity. And if the excess sugar, one thing real good is they dump the sugar out to urine, also bitter melon, also dump the cholesterol, and plus at the end of the day they dump the salt. And when they do that, the salt dumped out, then your blood pressure will come down, the leg swell is also come down, plus is also detox. Now, there's really a lot of people who have experienced Lowsutea. They say, hey, I drank Lowsutea. Even a younger chap, meaning at 40, 50 years old, they would say, wow, my leg used to be really swell up. Now my leg doesn't swell anymore because of Lowsutea. Wow, you know, such great stuff, right? And secondly, it also said my LDL also came down. And that is also really nice because when your LDL come down is going to improve your heart health, right? So that is something that how Lowsutea really works, okay? Now, 糖尿病者咧，其實話點解即係我 OK 咧？其實我都有幾個即係最近有好多人寫信咧，就寫啲 information 俾我哋咧，就話喂你個血糖茶真係好 work 嘅喎，因為我依家咧原本係6啊8啊，即係9啊10啊嗰啲咧好高，跌翻落嚟咧係得翻5點幾嘅，咁佢哋好開心嘅，因為10喎跌到5點幾好啊，咁所以其實咧。好多人都寫啲咁 note 俾我，影埋張相俾我，嗱，我有5.6啦咁啊，咁我真係為第佢開心喎。嗱，其實血糖茶只有2樣嘢嘅，第一個就係叫做快石榴葉，快石榴葉係將嗰啲糖咧 delay 咗佢嘅吸收，咁變咗冇糖入去血管裏邊，唔夠咁多糖入邊啦，咁即係叫糖入血管裏邊咧，我哋另外一個嘢就叫做苦瓜，苦瓜咧就將啲糖帶翻入去。嗰個佢增加咗胰島素嘅敏感個胰島素嘅敏感度咧，咁佢就帶翻啲糖咧入去細胞裏邊。咁你梗係用緊啲糖啦，但係 excess 嘅糖咧，佢就喺個尿嗰度咧係掉咗出嚟，同埋咧喺個膽固醇嘅掉埋出嚟，同埋鹽都掉咗出嚟。當鹽掉咗出嚟，血壓就會降低，所以三高都會降低，咁幾好啊！咁同埋仲有咧就有排毒喎，所以咧其實咧。飲血糖茶點解啲人話點解你飲兩公升咁多啊？其實好重要嘅，因為飲咗2公升嘅血糖茶咧，你血咧就冇咁熱，係dilute咗佢，咁你個糖又降低，又幫你有 enough 水分同你排毒啦。咁仲有咧，你係將你啲毒素掉咗出嚟，係咪好啲？好過你喺身體裏邊啊？咁呢個係血糖茶嘅功效嚟嘅。So it's really important when you have drink 2 liters of Lowsutea. Really help you because of the fact that it continue to give you detox function. Now, our company has really 5 programs to help you continuously. One is we're going to teach you about drinking Lowsutea, involve about low carb diet, low fat diet. So we'll continue to come up with a program to tell you what to eat and so forth, carb. Also tell you about exercise, 10,000 steps a month, per week. I mean, no, 10,000 per day. And then you have about 150 minutes of exercise, so at least you can able to keep up. Also weight control, you can lower your weight to at BMI of 23 with Dr. Wemler Professor Wemler every week to continue to educate you, to get you motivated, holding a hand throughout the diabetic journey to help you understand what to do. And certainly blood tracking, and so that way we can able always help you understand what to track, how to track your blood, how to track your food, how to track your weight. So when you track it, you understand where you are at. We hope we can bring your A1C down from 10% all to 5.7%. And we saw a lot of customers now actually able to do that. Now, they might not always everyone go to 5.7, but many of them go down to 6 or 6 below. So that will be a very good improvement. 10 to 6, imagine that. So that is what we'll try to achieve. 嗱，各位朋友，我哋公司咧唔係淨係叫飲茶咁簡單嘅，我哋仲有教育性上啦，好似呢啲咁嘅講座啦，每個禮拜都有啦。咁我教你係用咩食物啊，同低脂肪啊，令到你係降低你血糖啦，同埋點去運動啦，每日行大概8至1萬步，8千到1萬步啦。仲有你嘅 BMI 咧，你重磅咧係降低你到23啦。你聽我哋而家護理嘅講座啦，同埋每日去度血糖，同埋度你自己身體嘅食嘅嘢啊，同埋磅數啊咁。咁然後你有晒呢咁做工作之後咧，哇！你身體就會好啦。OK， 咁So now we move on to our actual subject to say, okay, how is diabetic related to your stroke? Now you might say, well, does it matter though? It truly matters. Because a lot of people say, well, how do I know I will get that? Matter of fact, people didn't realize stroke is a silent disease because you are not usually get a lot of symptoms and suddenly come bang to you again. Okay, so you got to be very concerned about stroke. And certainly there's things that come along will let you know the stroke might be coming, but you don't feel it. Okay, and some of them is actually your blood pressure. That is the definite one. But anyway, before I go into that, let me just give some general background why diabetic have stroke and what is the type 2 diabetic, so you get to understand a little bit first, okay? Because there are a lot of young people, a lot of newcomer here too. 各位朋友，其實咧糖尿病呢個中風咧係一個好多人 miss 咗嘅。個原因咧就係因為佢係冇任何痛苦啊，冇 sign 嘅 symptom 啊，亦都冇你感受 except 嗰啲係帶動嘅東西咧。就嚟睇到，咦？你可能有機會上去喎。第一個就係你血壓會上升嘅，上得好高，即係過去180度嗰啲啦。同埋咧，你如果你血糖繼續高咧，咁你知你嘅風險就嚟喺度啦。但係當你嚟嘅時候咧，可能好快 bang 咁嚟咗㗎咯。OK， 咁我特別要解釋下咩叫糖尿病先。咁你有啲了解喺度，咁砌上去咧，咁你就知了解我講咩嘅。So the important thing is we all recognize what is diabetic. So we all know our body not using properly our insulin, and then the blood sugar continue to go up. And the type 2 diabetic, and mostly 95% of patients are that type 2 diabetic, and also is no longer only older adult like 40 and 60 years old. Now, where people are 30, 20s are moving into that. Diabetes, type 2 diabetes. I was said, wow, when I go to nursing school, which is way back many years ago, that was say only an adult will have it. But now we saw like it. The reason is that diet, they don't work out and continue to be that. That's why they have it. 嗱，各位朋友，我因為或者因為好多新嘅朋友入嚟咧，我都俾佢了解下咩叫糖尿病咧。糖尿病就係我好多糖喺度，但係我啲胰島素用唔到嘅，咁我糖尿病喺嗰度血管上升啦。95% 嘅現象嘅糖尿病嘅都係2型糖尿病，同埋咧依家近時咧就只係40至65歲咧，但係其實依家咪係好多年青人都有糖尿病嘅，所以呢個咧係要好注重啦。So let's identify what is stroke. What is really stroke all about? Why would we have to so worry? Now, certainly there are a couple types of stroke, which you gotta understand. Stroke is not only one type. Now, one of the issue is, as you know, the artery and vessels are carrying blood all over the body, right? And usually carry oxygen up to the brain because you have to have blood cell get to the brain. However, what happened is when you have blood sugar is very high and start plugging up, and eventually some of these blood vessels are no longer getting blood at the other end of the brain. In other words, these vessels, and it's plugged up right here, so blood will no longer get there. So those brain cells is going to start dying, and they die in only a few minutes, maybe 3 to 5 minutes, they die. Once they die, the stroke will occur. So you don't feel suddenly, I can't move my arm or I can't talk, you get stroke. I will give you other signs and symptoms. But the more important is the blood vessels, whereby the sugar and the cholesterol get together, stuck, so plugged up, the plaques are formed, and then suddenly just completely to plug up all these micro vessels. And with that, the brain is not going to get, sufficient blood supply, and for a longer period of time, few minutes, the back part or the area that supply brain, they will die. And that result, then your stroke will occur. Now, this is called ischemic stroke, which is commonly if you can able to get to the hospital fast, you definitely, they will give you medication to maybe able to dilate the vessels so you get more blood supply. So the golden time is like 45 minutes. So that's why you have to go to the hospital real quick when you have that. Now, the worst thing is another one called hemorrhage stroke, which is you have a high blood pressure because you're diabetic, your blood pressure is continue to be high, over 180, and then you have some vessel which is weak, suddenly you pop, and then when you have a rupture, you have hemorrhage stroke. Now, this in the brain is very detrimental. You know why? Because usually older age, like 60, 70, 80. Surgery for the brain is going to be much more difficult because of age. On top of that, depends on where you are hemorrhage. You can't say, like, for example, if my hand is really injured, I'm bleeding, I can put a hand over here and stop the bleeding by pressing it down, and I could say, okay, I can stop the bleeding, right? Unfortunately, the brain, you can't press like this, it won't work. You have to go a surgery, or hopefully that will stop by itself. But the problem of the brain is that the brain, the skull is a bone. It won't, when the brain is swelled up, it won't enlarge anymore. There's no space. So gotta be a surgery, open up the drain. If you don't get drained, you know what? The brain will continue to swell up. Eventually press down to a certain part of the brain. You will stop breathing. Eventually you die. I saw so many patients die with that, including my mother, my own mother, which is feel very sad because I can't do much. I just saw, I said, oh no, he is a breathing, a hemorrhage, stroke. It's going to be very difficult for her to survive. And her time is going to be maybe 1 week or maybe, 10 days. That's it, done deal. So, this is something that I saw many times. And even I myself try to deny, oh, can I be, maybe she can get well. But when you have a hemorrhage stroke, when you're 60 to 80 years old, the chances of that is going to be very tough because you have to have surgery. If you're 25, surgery, okay, brain surgery, open the brain, you can remove the clot or remove the bleeding or stop the bleeding. That can be done. But when you're 60, 80 years old, most likely you can't survive. So these two stroke, one is called the ischemic stroke, which is a little better chance to survive because this clot here, it can't supply blood to the part of the brain. So maybe perhaps you get medication to quickly dissolve the, dilate the vessels so get blood for supply there. Then you get better chance to survive. But if you have a hemorrhage stroke, hey, I'm sorry, that is maybe really tough. I treated many ICU patients, a hemorrhage stroke. The chances of surviving is extremely not good, except if they're young. So really, I think stroke, this two area of the stroke, you got to be really concerned. And that's why I said, if you're diabetes, you want to make sure you keep healthy, not to get yourself in stroke. And I hope I explained this stroke enough that you understand it. 嗱，各位朋友，中風咧係有兩種中風嘅。第一種中風咧就係個血管啱咧就係你嘅血嘅啲 plaque 喺度啦，塞咗啦，咁就去到後邊嘅腦嘅細胞係冇咗食物冇咗氧氣嘅血流到去嗰度啦，咁嗰邊嘅腦咧就開會死㗎咯喎。死嘅時間咧係好快脆嘅，幾分鐘嘅啫。咁當你有幾分鐘嘅時候，所以你如果中風咧，就唔係佢去睇醫生啊，要即刻入醫院嘅原因，你個 golden time 就係40零分鐘嘅啫。 咁佢可能夠用藥物咧，就可以能夠將佢個血管係即係大呢咗，即係漲翻高啲啦。咁你有啲血流翻嗰度咧，咁你就可能夠救到呢個病人，同埋佢可能夠快啲嘅痊愈咧。但係第二種嘢咧就弊啦，因為你個血管直情係破咗嘅，即係穿咗嘅，啲血係咁流出嚟。嗱，普通嘅手你流出嚟嘅時候撳住佢咧，咁你就可以撳住佢唔好流血啦。但係可惜個腦冇呢樣嘢喎，你冇一聲撳住喎，咁你要開腦喎，開腦好難嘅。第二樣嘢，你多數都係60至80歲嗰啲人士啦，開腦你係個 survival 唔高嘅。咁相比咗嚟講咧，呢個咧係一個好大嘅問題，同埋個腦咧係一個你個skull係一個骨嚟噶嘛。咁你腦脹咗嘅時候咧係冇地方走嘅喎，咁你個血管一路係咁流血咧又撳唔到佢啦，咁你個腦咧就開始咧係 compress 一啲地方咧，你可能咧就一路係咁壞咧，同埋咧佢去唔到嘅時候咧一路脹咧，咁你就弊啦，你就會開始咩啊？你就會死亡，因為你透唔到氣啊，多數係吸咁樣嘅。所以變咗嚟講咧，你中風咧喺呢兩個大風險，第一個就係血管淨係爆咗喺個腦度，一個咧係塞咗。咁嚟緊塞咗咧，你嗰個就好啲嘅 ，OK？Rather than 出去嗰個就麻麻地嘅 ，OK？ Now, why diabetic and stroke are related? Because don't forget, as I mentioned, your body will basically produce, after eat, you also have sugar, and then you have insulin to go throughout the used to take your sugar into the cell, right? But unfortunately, because of that, you have always a high blood sugar. So your vessels are also usually become hardened, and also is no longer soft. And on top of that, they have all kinds of plaques and plug. And that's where the patient is going to be have all these potential stroke, where the mortality rate is going to be high. Because if you're stuck and you don't treat it right away, a few minutes later, those areas will die. And depends how much stuck you have. So that is the key. In diabetic, why is even worse? Because normal person, the vessels are at least soft and functionable. But you're diabetic, you're long time sugar, your blood vessels are all hardened. And that result, those vessels are no longer as easy being treated. And so you stuck on those particular areas, the brain will die, and you also have a tremendous problem. 嗱，嗰個糖友，因為當糖好高嘅時候咧，血管開始硬化，好多硬化嘅時候咧，血壓會上升啦，仲有嗰啲血糖，如果你係真係呢個 stroke 嘅，即係呢個係塞住個腦嘅血管喺個腦嗰度咧，咁如果你啲血管係即係能夠可以唔係硬化咗嘅，咁梗係容易穿㗎啦。但係多數糖尿病血管係硬化嘅，咁所以變咗嚟講，佢就唔係咁容易咧，好快脆咧就能夠即係食藥啊，或者可能夠俾藥佢能夠令到血管可能夠大呢咗啊，即係大嚿啲啦，咁啲血管流翻出去咧，呢個咧好多時都係話即好難叫控制到呢樣嘢，所以結果咧係死亡係高好多嘅。Now, so the real issue is how are you related this with diabetes and stroke? Now, first of all, if you are diabetic and you already obese, where I'm overweight, I have a big tummy, I already have a heart problem, I have high cholesterol, I have high blood pressure, and so forth and so forth, then the chance of a stroke is extremely high, okay? And a lot of people, I think majority of diabetic patients, they already know. If I have diabetes, usually they have also 3 other medications. The first one, you're going to have metformin, and then usually you have also with blood pressure pill, which is like Norvac or Lowsutea, that kind of typical pill. And then you also have a cholesterol pill, okay? So all these 3 pills are always continue to be in your pretty much your regular medication. Now for pre-diabetic patient, you always will have probably these 2 pills coming out, blood pressure and or your cholesterol pill. So all these people who have, the sign as like, for example, obesity, high cholesterol, high blood pressure, all these become your risk. So you really, once you get that, you got to start looking at, wow, will I have stroke? Now, certainly nowadays it'll be good because you buy a pressure cuff. It's very cheap nowadays. It's maybe $50 US, or Hong Kong is about $400. You get a pretty good cuff already. And you got to measure every day, morning and evening. So at least you always get a baseline and write it down. So net result, you always have that information with you so you know where you're at. The worst thing you do is you don't know, you don't measure, you continue the same lifestyle, and your cholesterol is high, your blood sugar is high, then your risk will be certainly extremely high related to all these continued health issues. Your stroke will be maybe one of the problems that you will hit, okay? 嗱，各位朋友記住，當你係有呢個中風嘅問題裏邊咧，有好多人咧，如果你係肥胖啦，又有大肚墩啦，有心臟病嘅問題咧，有高膽固醇 ，especially LDL 膽固醇啦，同埋咧高血壓嘅朋友咧，你個機會去有嚴重嘅中風咧係好高嘅。嗱，呢個係一個 always the case 㗎。嗱，好多時咧，我係前期患病啫喎，我依家只係食緊一隻藥，就係高血壓啫嘛，我未有其他嘢㗎。咁但係膽固醇咧 eventually 會上嚟嘅，咁你就多數好多人咧就前期患病，梗係膽固醇上升啦，血壓上升啦，但係血壓未有到去食藥嘅階段，咁你嗰陣時咧真係要做嘢咯喎，因為咧如果唔繼續做嘢，你嘅 stroke 機會又開始高嘅。咁仲有啦，你依家糖尿病啊，當然有3種藥㗎啦，一個就係metformin啦，第二個就係你嗰啲血壓藥啦，即係 Norveg 啊，或者係 Lowsutea 啊，第三就係你個呢個膽固醇藥啦。嗱，依啲咧全部都係俾你嗰個東西咧，係希望你能夠降低三高嘅。咁當然啦，依個你飲血糖就會好有幫手嘅。就算你前期或者係糖尿病飲血糖 ，definitely 幫你係降低你嘅膽固醇啦。血糖嘅，咁令到你中風風險就低咗啦。但係如果你係呢咁嘅 category 咧，到嗰個係 very good 嘅，好高嘅。OK。So now let's talk about a little bit about symptom. Now symptom is so important. Reason is because stroke usually don't exhibit any symptom until really you already got stroke. Okay. So first stage, you better start understanding your regular vital, meaning your blood pressure is going up all the time. You have you go to see a doctor, you know that your cholesterol is high, and also your blood sugar is coming up, or you're pre-diabetic, your blood sugar is coming up, eventually move not quite in diabetes stage, but you're already going up. And then your cholesterol blood pressure is already going up. So you have to continue to monitor. Now, but on the other hand, if your stroke suddenly come, these are the signs and symptoms will come quickly. First of all, a lot of people will start feeling numbness of the hand, you know, meaning that the body one side kind of got numb, cannot move, and you want to move it, it doesn't work. So that one is definitely will start showing worse and worse and worse. And then if you have starts feeling that, and your speech becomes blur, you know the word, but you can't say it. And on top of that, you start losing balance. You become unsteady, your gait is unsteady. And plus, you might be confused. And there's also a lot of people have sudden headache. Oh man, my head is really sore. And also, some of them will get blurred vision. Now, all these symptoms is not to allow you to say, well, maybe I go see my doctor, and the doctor say, well, I'll give you a next week appointment. Forget that. Go to hospital, because this is a sign and symptom of potential stroke. You better go to hospital right away. Now, a lot of stroke patients, usually they don't have any pain. They just very suddenly become real weak. And also they start uncontrollably voided, meaning that they pee on the floor. And a lot of old folks have that. And when they pee on the floor, you ask them, they can't really answer you. Well, that is the problem come. Those are also stroke patients. So those people, you don't go to a doctor to tell them that, oh, I'm going to get a patient like that. You go to hospital, emergency. That's what you're going to do. So any of this symptom come about, you take up the treatment emergency right away, okay? So do not wait because these are serious. And that golden hour, 1 hour, will be the key to allow you to treat. If you over the hour, your patient long-term damage will be extremely high. So make sure, remember this. So you can take a picture. If you can understand this is going to be, this sounds simple. It could be not you, could be your husband, could be your relative, could be your mom. If they exhibit symptoms, go to see the hospital, emergency, not doctors in a private clinic, okay? 嗱，各位堂友或者朋友，有可能你前期患病都有呢個機會㗎。如果你係有呢啲任何嘅朋友係忽然間言語係清唔到嘅，係 slur 嘅，講嘢係講唔到，佢想講但係唔知講乜，同埋身體開始有啲麻痹呢度啦，有呢邊有啲痹啦，行唔到啦，已經講得好 weak 啦，仲有好亂啦思維，咁亦都有忽然間好頭痛啦，左邊或右手邊啦，同埋視覺亦都係蒙啦。仲有一樣嘢咧冇喺度寫低咧，就係有啲人咧開始覺得好快坐喺度就賴尿啊，開始賴尿係佢都常見嘅，但係你問佢咩事啊，佢係答你唔到嘅。咁呢個咧就係全部係呢個好嚴重嘅 stroke 嘅問題嚇。咁變咗嚟講，呢個咧就即刻要去咩啊？你而家即刻去醫院，唔係醫生 ，OK？ 去醫院記住。咁你可以影張相喺度先，咁然後知道咧，你影張相之後咧，如果有啲咁症狀咧，你快去醫院嚟睇醫生啊。Okay. Now, the typical way, if you are next to a patient that really have stroke or you are just a relative, you can ask them to squeeze both of your hands. See left hand, right hand, any weakness differences. If the left hand is weak or the right hand weak, that means he is starting that stroke coming, okay? So you can check the movement, can you move this way? But the key is squeezing both hands and to check. Now, that is the first easy check. You don't need any diagnosis. You can check and find out, are you able to speak? Are you alert? And so when the question you can see is that certain bleach, head cannot be equal, the stroke is here. So call ambulance, take him to the hospital, okay? Now, certainly when you get to the hospital, doctor will still do the same thing. But one more thing they will do is they usually quickly do an MRI or CT scan, because with that, they can identify where the stroke is going to be. Is it a vessel burst stroke, or what's it called hemorrhagic hemorrhage stroke, or is a blockage, ischemic stroke, which is the blood cannot reach to a certain part of the brain. That will determine by the CT scan. That's why you have to go to the hospital real quick, because go to the doctor office, they don't have any of these, so they gotta tell. So don't delay. Go to emergency immediately. Now, certainly they would do an ECG, could be a carotid ultrasound, and cerebral angiogram. But most of the time in the ER, they will very quickly do a CT scan or MRI that's really already understand where you're at. And usually this will be a hospital admission. It's not going to send you home. And you will be definitely will have to, be very quickly get treated by the doctors, okay? 嗱，喺屋企，如果你嘅病人係你同一齊嘅話，你親戚啊、你太太啊、你爹哋媽咪啊，叫佢拎住隻手揸實佢係有冇感覺？一邊係弱啲，一邊唔係咁弱。同你問佢答你答唔答到，唔清醒，speech slur， 呢啲咧全部係 stroke 嘅 symptom 嚟。咁呢個咧就即刻咧你要去見咩啊？要去醫院啦，去即刻要檢驗啦，就唔好帶醫生嗰度，因為咧你去醫院咧，佢會開始做一個叫做 CT scan 啦，或者做個磁力共振嘅腦啦，咁就睇到你個 stroke 係咪啲血管喺邊度壞邊度出血啊？或者係一個唔係出血係一個塞啊，呢一定要好快就知道嘅。所以帶你去睇普通醫生冇用嘅，佢冇啲咁嘅 equipment 睇咩嘢，冇得睇唔到啊。咁其他嘅時候咧，可能佢有個叫 ECG 啦、carotid ultrasound 啦，可能做呢啲咁嘅嘢啦，同埋有個 cerebral angiogram。但係 CT 同 MRI 係最快係最多人做嘅，所以記住佢一定有呢個方法咧去睇話你係咪咩個 stroke 啊咁。OK。 So really at the end of the day, how are you going to reduce this stroke risk? And later we'll talk now step by step so you can understand how do you decrease the stroke. Now, certainly I know many of our audience here, I saw quite a few of them, already 70, 60, some about 50. They are all in this category of the stroke, potentially stroke item, stroke patient category. So let's be real and be understanding you are at that risk. So let's take care of it. Now, to take care of it, there's several things to help you out. Although you're saying, well, I'm only pre-diabetic or I'm only diabetes. Will I get that? Yes, the chance for you is high, but you can able to help yourself prevent you become stroke. For example, first of all, you have to control your blood sugar. So how to control blood sugar? Drink Lowsutea regularly, 8 glasses, 8 cups a day, 240 ml or 8 ounces. Every time you drink 8 glasses. Now, a lot of people ask me, well, Andrew, how can I drink 8 glasses? Well, the reason is because you want to hydrate yourself. Your blood will continue to be not too thick, and then you will not able to plug everywhere. Plus, Lowsutea will lower your blood sugar, blood cholesterol, also your blood pressure, and detox. So that it become a very important element for you to lower that potential risk for you to get your stroke, okay? Also, you have to keep your blood sugar in a good range. Certainly, 140 is your maximum. You should go below 140, 130, 120 will be better. Or in Hong Kong, it will be 6.7 ml per liter. Now, you do have to monitor your blood sugar because you don't monitor your blood sugar like you got to take blood sugar with your Abbott test, or you can plug your finger, but you have to know. If you don't know, how can you tell, right? So go to the doctor, they will always take an A1C, and your A1C best to below 6.4. And don't get it higher, because when you get higher, it's not going to help you either. And you see today, my blood sugar is 5.4. So I had breakfast this morning and it went up a bit, but I drank Lowsutea, you know what? It came back down. So this is how you do it. And you got to do that all the time, because if not, you don't know where you're at. And then you have to follow your diabetic meal plan, meaning that you have to get your low carb diet. I always suggest half the plate of vegetable. Anything green vegetable will do it. Any salad will do it. And 1/4 is what? Your regular protein, which is fish, low fat chicken, no skin. You can no lean meat. Everything of that is good for you. And then 1/4, your starch will be like brown rice or red rice. They are very delicious, by the way. Certainly, you may say, wow, I don't know, I never tried red rice. Try it, because you will love it. Especially the red rice is a little chewy, it tastes really good. And with that, wow, you have now get yourself always in good shape, not to move your blood sugar up there. So that is important. Certainly, as I mentioned, you have to stay hydrated, because you drink Lowsutea 8 glasses of Lowsutea a day, with each glass is 8 ounces, then you are basically hydrating, your blood may not become thick. So that will be important. Certainly, you have to reduce sugar intake, meaning your carb intake. Now, I have a lot of friends, unfortunately, they will say, hey, I'm not eating carbs anymore. I said, what do you mean? Well, I'm not eating bread or rice anymore. So I said, are you eating other stuff which still have a lot of carbs? So the Chinese guy was saying that I still eat my char siu bao, the white bun. I said, wow, you know what? Although you don't eat rice, you don't eat cake, but you eat a white bun, it's the same. It's even worse, because the white bun has tremendous amount of carbs, will get you. And you eat bread, and so you got to choose the right of bread, which is like almond bread, or bread which is sourdough. Sourdough somehow has really low glycemic index. So you have to choose the right bread, not a regular typical white bread, or so that will be really not good for you. So you really got to eat healthy. Now with that, you definitely control your blood sugar. And I hope that you continue to practice that, then chances of you get stroke are much more reduced. And that's what you got to do. And that's homework. 嗱，各位朋友，你一定要咧控制你血糖，因為你唔控制血糖咧，咁你成日上升啲又係咁塞，咁就弊啦。咁你要控制啊，其實咧你血糖一定要喺140個 milligram per deal 或者6.7以下嘅。咁同埋 A1C 一定6.4以下啦，希望你嚇。咁同埋咧，你繼續咧係要食物嘅計劃啦，要喺度啦。你保持你水分啦，最緊要飲去糖茶，每日你飲8杯，係咪好多就係唔係？因為8杯只係得2個 litre 嘅啫，2個 litre令到啲血啦唔會咁結。咁你唔會結嘅時候咧，你就控制到咧，你血唔會係咁塞 ，OK？ 咁同埋咧，仲有你糖分咧，亦都繼續降低啦。千祈唔好話，喂，我都唔食餅噶咯喎，冇西餅我都唔食噶啦，甜嘢又唔食喎。但係你會食繼續饅頭先。我有個客係上海人嚟，佢日日都食饅頭，所以佢血糖好鬼高嘅。咁啊，你會食呢個饅頭得唔得啊？哇，唔得喎，食到成世啦咁啦。但係總歸改咗咧，哇，血糖降翻低喎，由高嘅80、90嗰啲地方咧，降到去6點幾啦。哇，幾好啊！淨係唔食呢樣嘢啫喎。咁同埋咧，仲有你食啲嘢一定全部一半係菜啦，1/4係你嘅魚啊、瘦肉啊，就係1/4咧係食個紅米啊或者brown rice 啊呢啲咧係會對好方便嘅。嗱，當然食呢個飯嘅時候咧，你會因為照多啲，但係個原因咧就係因為佢照多啲嘅時候咧，佢 delay 咗個糖嘅 absorption carb 嘅 absorption，so it's very important. Now, another thing that I'm sure many of you do not do this, but quit smoking. Because smoking really increases your triglyceride, fat in your blood, and all the good cholesterol it will decrease, which is the HDL, and make the blood become more prone and sticky and obstruct the flow to the brain and also to the heart. So why smoke, right? So let's quit smoking. I know it takes effort, but quit smoking. 嗱，食煙咧係有好問題嘅，因為食煙咧增加咗血液中嘅脂肪啦，同埋 HDL 降低咗佢啦，同埋仲有咧係令到血係好結啦，同埋咧仲有令到更加塞你個腦同心臟啦，所以變咗咧戒煙係好重要嘅。Also, when you smoke, you also damage the blood vessel lining cells, increase the plaque formation in the blood arteries, including accumulated fat, cholesterol, calcium, all the other materials in the blood vessels, and also get the blood vessel become thickened and narrowing. Imagine that. Smoking does all that. Plus, we didn't even say, hey, smoking, you have a high chance of what? Lung cancer. Wow, man. It's not only diabetes now, you also can involve cancer. You don't want to be in that boat, man, because cancer will be a tremendous take away your whole life. It's hard to treat, and you basically very suffer. So do not get yourself into cancer, okay? So quit smoking, do quit, because that will be big benefit for you. 嗱，唔食煙咧，仲有唔會損壞你血管嘅裏邊嘅細胞啦，同埋血管咧，亦都唔會好咧脂肪嘅嘢塞咗喺度啦，膽固醇啊塞啊，同埋咧仲有唔會令到血管咧係硬化同埋即係窄咗佢嘅。咁所以變咗嚟講咧，食煙係好緊要，同埋仲有食煙咧，即係戒煙好緊要。如果戒煙之後咧，仲可以做一樣嘢咩啊？你黏咗個 chance 係咩啊？肺癌啊！哇！你當有肺癌嗰時，認真唔係咁正仔，係好慘，好 suffer。Okay， and I must say, all of us, in a sense, that we have to continue to stay active. In other words, you have to walk. Very much just walking will be good. Now, certainly it will be good to do some aerobic exercise, jogging, swimming, dancing, cycling, garden, tennis. But I found that a lot of the elderly folks that I can't run anymore, which is good. That's true, because the knee running is not so easy for elderly. But really important, you have to do exercises walking. Now, aerobic exercise, or you have a barbell, you even a step master, just go up like this. And every day, do 30 minutes. We'll do it. And I know it takes a little effort, and I watch TV doing this, and I do this with my barbell, and I do my walk master, do this. Up and down my walk master. I bought my walk master for $50 US, $400 Hong Kong. It's cheap, it's good, Even outside is raining, it doesn't matter to me. And another thing, a lot of my friends now, they actually, husband and wife, after dinner, you know what they do? They walk around what? Shopping mall. Wow, they enjoy, they see some new idea of shopping mall. They don't have to buy anything, just get a few. So wonderful experience, right? So keep doing your exercise, stay active. And especially when we're older, we gotta keep active. Don't just sit there and don't do much. Now, I have a patient who is kind of elderly. He said, hey, Mr. Lau, I already do a lot of things. Yeah, I already cut my diet. My carb is controlled. My sugar is still up there. And one question I asked, have you do exercise? Have you lowered your weight? And she was saying that, well, that's what I did do. So if you don't exercise, you lost 10% of your weight, your A1C will drop 1 point. So in order for her to do that, and which she start doing, and I tell you, it took a lot of effort, a lot of encouragement. When you start doing that, that will be the key to lower your blood sugar. Now, certainly, I think a lot of people from Hawaii here, I saw a bunch of them. You can walk around your neighborhood. That's good enough. It's nice and cool. And you can just walk with your dog, doesn't matter, but just walk around the neighborhood. As you walk 8,000 to 10,000 steps, that you achieve that. So do a lot of walking. And also you have to try to lose, besides excess weight, as I mentioned. And also you basically, if you go to a sports center or a health center, you get a coach to help you out. But I found majority of people to start off very easy. It's just walk. Let's do walking. And then if you have a little bit more by 1 pound barbell, just do this up and down. You know, just do this up and down. And then to 30 minutes, and you already done the stuff that I just asked you guys do about. And you can do a step master, get $50 a step master, very cheap. They even record how many calories you can burn, all that. It's getting more and more sophisticated, by the way. And it's easy to do. Rain and snow doesn't matter. You can still do it. So stay active, my friend. 各位做運動係好重要嘅。嗱，你唔做運動咧，其實咧係做唔到你需要點降低血糖嘅。嗱，你就唔食嘢，唔食即係有糖嘅唔夠嘅，因為咧你要做運動先 burn up 咗啲糖咧就交你嘅。咁其實點做啊？其實好簡單，散步。兩公婆行下 shopping mall 夠噶啦，每日行1個鐘，哇 so good， 又有冷氣嘆，傾下偈，睇櫥窗幾開心啊！咁當然啦，你可以跑下步啊，咁但係你到老嘅時候跑步唔係咁方便，或者游水啦、跳舞啦、踩單車啦、園藝啦，呢啲全部得嘅。但係我翻屋行咧係最方便。咁當然啦，如果你係能夠降低你10%，即係10%你磅數咧，你係降低1個 point of A1C 嘅，1% 好緊要喎。如果你8，你掉到7嘅咯喎，7掉到6嘅咯喎，繼續佢嘅。我已經做咗啦，我係跌到依家係掉到5.6嘅 A1C 啊，所以係好嘅一隻。嗱，當然咧，你5.6咧可能上翻去6嘅，或者5.9嘅，或者5.8嘅，唔緊要，但 under 6就 OK 嘅。呢個數字唔會係以後一樣嘅，你係上上落落嘅。但係 good you are there，OK？ 咁最近咧就需要，譬如你話即係我去個健身室嘅，咁 OK 啊，揾個 coach 教你冇問題。但係我香港人最多係做咩啊？我記得佢係全部行路，係好正。但係行到老咧更加正，因為你行到老咧，如果你一係咁行一行咧，個 chance 你個骨骼係硬咗唔會啊，所以 be so important 繼續行 ，OK？On top of that, you have to maintain a regular bedtime to ensure you have get enough good sleep, to wake up at a certain time, go to bed about the same time. You know, I have a friend over here. His name is Wason. Every day he actually sleep at 9 p.m. I mean, excellent. Every day they don't go anywhere. 9 p.m. go to sleep. Wake up at 4 at 5 o'clock. He is in Kapilani Park walking. Wow, that's really cool. Because that will even get him the real good monitor and everything to do that. That will be very good for him. So get regular bedtime and sleep, wake up at the same time. 嗱，各位朋友一定要繼續保持咧你瞓覺嘅習慣。譬如我每日11點瞓覺或者10點瞓覺，做呢樣嘢。朝頭早5點鐘起身5點鐘。咁同時上去瞓覺咧，咁尤其是咧你咁做法咧之後咧，你身體係有個好嘅 regulation。 Now, you also blood pressure, you have to monitor because if you don't monitor blood pressure, you don't know is your blood pressure high or not. So you gotta have at least check your blood pressure every day. If you're pre-diabetic or diabetes, doesn't matter. If your cholesterol up, you can check it every day. It's very simple now. In fact, you can get right now it's like $50 to get a very good blood pressure cuff already. You go to Logs, you go to any supermarket, even they sell that. Get a blood pressure cuff, get it in there and measure a couple times every day and write it down. Because a lot of time you don't write it down, you forget. So write down today, my blood pressure is 120/80, for example. So you got to make sure that you do it 1 to 2 times. Actually, you should do 2 times, one in the morning, one in the evening, before you go to sleep is good. And also make sure you take your blood pressure, not doing come back from a walk or after exercise, because you know what, when you exercise a lot, your blood pressure will be high, so you might mislead yourself. So do it when you sit down for 20 minutes or so, or 30 minutes, then you take a blood pressure. That would be the best. Do that. Now also another time, like read the blood pressure, some of left or right arm might be a little different, so do it 1 or twice on both arms is okay, because your blood pressure is there, it's free. So do it, check it, but write it down so you know. 嗱，每日咧你都要自己去度一度你個blood pressure 啦，因為唔度個blood pressure 你真係唔知你係點喎。每日要度2次，起身之前就瞓覺，同埋千祈唔好運動後咧就讀 blood pressure， 因為嗰陣時咧就一定唔會準確嘅，會係高嘅。OK， 咁呢樣嘢咧就記住，就係坐低最低20至30分鐘先再度，咁就會 make sense 㗎啦。Okay, so you got to eat healthy, reduce your carbs. Now you got to remember, you get only 150 grams of carbs, no more than 200. That would be best ideal. So you also remember, you have the portion size, half vegetable, 1/4 protein, 1/4, your starch, and for a lot of high fiber diet. And then you don't want to eat a lot more processed food, for example, where prepackaged food, those forget that one. If you can cook yourself, that's the best. You got to drink a lot of water or drink a lot of Lowsutea. I think that's important. Lowsutea help you dilute your blood. And then you can eat a lot of fruits, vegetables. It's okay. Eat a lot of apple even. Apple is good. It's a low glycemic product. A lot of pears is good. Try that. So eat a lot more fruit, vegetable, get high fibers, okay? 嗱，每一個堂友記住，我哋要食好多碳水化合物嘅東西，唔係減低碳水化合物，食好少碳水化合物，因為你每日咧只係150個 gram of 碳水化合物食物，同埋係都冇200啦。咁你每一餐分翻去啦，要食多啲纖維食物啦，最緊要唔好食咁多碳水化合物啦，即係話 high carb 嘅時候降低咗佢啦。咁同埋咧就唔好食嗰啲加工食物啦，尤其是喺出邊買啲食物翻嚟，或者即係好似嗰啲所謂叫做granola， 就算係俾你去加啲營養嘅，但係嗰啲全部係 process 嘅。咁要飲多去糖茶最緊要啊，因為唔好飲水飲去糖茶，咁你更加一定會更加健康嘅。同埋降低鹽分啦，同埋食多啲蔬菜啦，同埋最緊要食多蔬菜水果。OK， now this is a big issue. A lot of people, especially elderly, forget the medication. Now, certainly I ask everybody to, if you take medication, get a little, go to Logs or go to any pharmaceutical. They have Monday, Tuesday, Wednesday, Thursday, all the way 7 days, and all the meds are there. So do take one of those so you don't forget your medication. Let me share with you why. A friend of my mother forgot to take her medication for a week, and that's her blood pressure medication. You know what? Her blood pressure went up to 300. She got a stroke because she forgot her medication. It went up to 300 something. So the medication is really help you to make sure lower your blood pressure and cholesterol or your blood sugar. If you don't take your medication, you know what? You are going to have a risk of stroke, heart attack, whatever the disease you have, you are going to be possible getting that. She just forgot within a week, you got it. And so medication is so important. Now, on top of that, you got to also understand OTC medication also have sugar, so you have to take all that consideration. And also keep the medical appointment to see a doctor for sure. Because if you forget your test, because the doctor go there to medical test and check your blood, you forget, your blood could be changed sometime 3 months later. So a lot of people now come back to me, Andrew, well, I was really good. You know why? Because 3 months ago, my blood sugar is, high. Now my blood sugar is really good. I'm now 5.6 or 100 or so. So they're very happy. The reason why they're drinking Lowsutea. So these are the things that encourage you to become healthy. On top of that, these people say, hey, Andrew, I did listen to you. I walk. I do Stepmaster, or I do my barbell exercise, plus I eat really healthy. In the sense that half is all vegetable, 1/4 protein, and 1/4 is brown rice. They did all that. You know what? The result will come around. You know what? They no longer have the high blood sugar, high cholesterol. The cholesterol continue to come down because not only Lowsutea, the drugs that they have are going down. And the drug they took also minus. The doctor said, hey, you're doing so good. We'll lower your diabetic drugs or lower your cholesterol drugs. So those are things that's really wonderful. So keep track of medication. 嗱，各位朋友記住，藥係好緊要嘅。你唔食藥咧，血糖會上升，其他身體你血壓亦都會上升。我有個朋友個媽咪咧，唔記1個禮拜去食藥，佢個血糖佢血壓咧上300幾度，咁就爆血管啦、中風啦，咁又瞓喺醫院啦，真係好慘。其實佢可以全部預防到嘅，只係食藥嘅喎，唔食藥就冇啦，係咪？咁你唔可以唔記得食藥，亦都唔好唔記得睇醫生，因為睇醫生咧，佢一定會度你血糖啦，或者去度你血壓啦。咁我好多朋友依家講翻嚟咧，就 after 3月啦，又食咗血糖茶，佢原來好喎，因為你個血糖茶幫咗我咧降低咗血糖啦，我個 A1C 咧跌到依家係10以下，上邊咧我可以跌到6點幾㗎啦。咁佢埋仲有咧，佢膽固醇亦都降低喎，咁幾開心啊 ！OK， 成日都翻嚟話俾你聽。Okay, now really at the end of the day, you're gonna have, if you're diabetic, they also have stroke related. They usually treat you with the clot burst medication, where they would have all different types of medication to thin out your blood. Now, certainly you might get baby aspirin. Also, they certainly some of the stroke patient, they have a surgical, they put a stent on the carotid artery. They also get you to get nutritional expert to work with you to make sure your sugars, your carbs are good. They also have psych counsel and also physical therapy. If you really have a stroke, you need physical therapy, you need speech therapy, occupation therapy. But all that, you really don't want to be there. That's why you don't want to be a stroke. Because you are stroke, you are basically usually end up in the hospital a long time. The cost of medical high. Wow, forget it if you can. So the best thing is not to get that. Okay? 嗱，各位朋友，如果你係已經中咗風嘅話咧，你一定會有好多藥物去食啦，就等多啲血管唔會硬化，同你 clot 唔會 clot 咗喺度啊，俾血要去到腦嗰度啊。咁有時亦都會有機會咧做一手術啦，俾個肢解喺度啦，咁變咗啲血管係上到腦啦。咁亦都有可能夠揾個營養師幫你搞掂佢食嗰啲 carbs 啊，唔好食咁多啊，肥唔好食咁多啊。咁當然啦，你因為中咗風好多時你會 depress， 咁你變咗你就會心理專家有啲 psych counsel 俾你。咁但係仲有咧，好重要嘅 stroke 咧，一隻手唔行得喎，一腳唔行得喎。咁佢多數咧就有職業治療啦、物理治療啦、言語書治療啦，呢個常一齊嚟㗎。咁但係我都希望你唔會行呢條路先，最緊要依家我今日講咗咧，希望你唔會行呢條路。So keep that in mind, diabetic is definitely have an increased risk of stroke because of the fact, don't forget, your blood, your cholesterol, and your sugar become thick and stuck everywhere, your brain. Importantly is some of that plug is so bad that if the blood cannot go through, the back of the brain will start dying. And that will be a good, what I call ischemic stroke. And that is really, you got to be very quick to the hospital to basically very quickly get treated. If you're blood pressure is high, the vessel is hardened, it might burst, and that even more dangerous because that will make you have a very lesser chance to be healed. And so that will require brain surgery. And you are 80, 90 years old, chance of brain surgery will be minimal. So you are usually have a higher risk of dying. But importantly, I want to make sure that you yourself has to prevent that even before you get to there. So you have to manage your weight, your blood pressure, cholesterol, blood sugar level. So actually decrease the risk of the stroke. So how do you do that? It's very simple. Basically, you got to make sure that you control your blood sugar, you got to quit smoking, you stay active, maintain your regular bedtime, monitor the blood sugar, blood pressure, regulate, every day, measure 2 times, eat healthy, and then don't forget, take your high blood pressure medication, your blood sugar medication, and your cholesterol medication. Last but not least, drink Lowsutea. And that will definitely help you to prevent your stroke. 嗱，各位同學記住，中風係真係喺度係嚴重嘅。如果你唔注重呢樣嘢，你可能真係變咗殘廢。所以關注個體重啊、血壓啊、膽固醇啊同血糖咧係好重要嘅。呢個全部係降低好風險嘅。咁點做啊？第一，好重要咧就係你個血糖要控制到啦，即係話要 under 6個 A1C 啦，6.4% A1C 啦。食煙唔好食煙啦，繼續努力 exercise 啦，同埋咧仲要有個瞓覺時間一樣啦 ，monitor 你嘅血壓啊，每日2次啦，仲有咧食啲嘢咧要好健康啦，同埋咧就係記住食你嘅血壓丸，你嘅膽固醇丸，同埋你嘅血糖丸同埋最後飲血糖茶。嗱，做晒呢嘢咧，你就可以降低你嘅風險嘅。So really at the end of the day, you got to basically got yourself to be really control your health by really doing it yourself with a diet, with exercise, and your weight. And then at the end of the day, your blood sugar will be greatly decreased. So you are continue to maintain a healthy level. The chances of stroke are really going to be decreased. Your medication is absolutely important. Don't forget your medication, especially elderly. It's so important when you open a pack. Oh, how come yesterday I didn't take my medication? Or 2 days ago, you already didn't take a medication. I have a lot of patients forget about that. And they come then, they're in the ICU already, a stroke. And the children come back and say, oh, my mom didn't take my medication for about 4 or 5 days. Wow, or a week. So that is truly a sad story. And I saw many of those already. So keep in mind, diabetic, pre-diabetic, you don't get well. You only can control. And how do you control? You basically control your diet, exercise, and then your weight. And you got to continue to control your 3 high, and that result, you can able to get well. So I hope that this will be a good webinar for you. And you want to write to me, you can write down to andy@wafong.com. Communicate with me so that way you have any question, we'd love to answer you, help you out. I have a lot of people actually send me comments now to say how Lowsutea can be helping them to lower their blood sugar, lower their cholesterol, lower the blood pressure, the 3 high, and also many of them felt very good drinking more Lowsutea. They felt that because drinking more Lowsutea, they feel a little more cleaner, the blood sugar improved, and that's really encouraging because a lot of people actually show me even the slide that they actually measure themselves. They say, hey, I used to be 10 or 8 or 9. Now I'm 5.6. That means they have 100 milligram per deal. Wow, how exciting. So I'm so happy and so grateful. This patient are so encouraged to continue to improve the health through better management of the diabetes and preventing stroke, heart attack, and so forth. So thank you again. I hope that you have a nice weekend. If you have any other question, feel free to drop the question onto the chat box. We would love to answer you. We're going to have one more week. Actually, the 17th is our last week to have lecture for this year, because after that will be the 24th and the 30th. Both days are just before New Year's. So we're not going to have lecture, and my lecture will come in January the 14th. So I just want to let you know. So if you're going to have, thinking of going to lecture, we did not disappear. We just holiday, nobody will come to listen. So we'll just make sure that everybody will go back to normal time. So January 14th, next week we still have one more lecture. And next week lecture will be a really exciting lecture. It'll talk about aneurysm. In other words, what happened, your blood vessels just sort of burst because you're diabetic. And it happened all the time. I treated many, many patients in ICU. And aneurysm just started, boom. And wow, that would be scary, tell you, because that has to go to hospital immediately. So we'll give you all that information so you at least know what's going on. So thank you again. I appreciate any other question. If you have no question, I appreciate your time. Listen to the webinar. And we really hope that this information, because I think stroke is really important, because at least you now know you don't go to the doctor office, you go to emergency to get understanding right away what happened to you if you are really stroke, so we can get treated immediately. Okay, thank you again. Have a very nice weekend, and I'll see you next week on this. Actually, for Hawaii will be 16. For Hong Kong will be 17. I will see you 16 and the 17. 16 for Hawaii, 17 for Hong Kong. You take care December, okay? Take care. Bye-bye. Thank you very much.